Hello everyone, I am Dr. Swapnil, your brain and spine doctor. Today we will discuss about one of the most common presenting symptoms, one of the most problematic things is headache. So there are so many people who will be regularly suffering from headache. So what are the common causes of headache which we will be daily seeing is, first is the tension type of headache, which happens basically because of the stress or excessive working hours or improper sleep and all. That is a tension type of headache. Second, what can be there is a migraine, which is more commonly in the 20s, 30s, and 40s. So, which happens because of the different triggers. A patient keeps on having migraine, which is specifically a one-sided headache. Third can be a sinus headache, which can be because of the cold exposure or some sinus problems. Patient may have a sinus headache. So, if you have a headache, the first question you will be having is, when should I visit a doctor and why should I visit a doctor? So if your headache is associated with, if your headache is very sudden, severe type of headache, it is associated with blurring of vision, you are not able to see properly. If it is associated with any weakness of limbs, or you're not able to walk properly, you're not able to hold anything properly, or if you are having seizures associated with that, or if any of your function is affected, like you are not able to hear properly, you are not able to talk properly, in such cases, definitely you have to visit your doctor so that nothing alarming is there in your brain. You have to get evaluated for that. Now the other question which comes is like how the doctor will evaluate you. First is most important thing is like the proper history and the symptoms which you are presenting. The doctor will examine you, like if anything is problematic is there. Accordingly, a brain or sometimes a spine scan may be required for you to evaluate what is causing a headache. Regarding the treatment, most of the time, like we will be giving some medications that help the patient to have a relief from the headache, and most of the times it works out. But sometimes the treatment differs as per the brain scan. If something comes out alarming, then the treatment differs accordingly from the condition, as per the patient's condition, and as per the patient to patient it differs. So the last thing what we should discuss is, definitely, even though there may be something alarming inside the brain, most of the things like brain tumors and all also may cause a headache, but the most common cause of headache is the stress, anxieties, the working hours, or a improper food or improper sleep. Most of the time it is manageable, and most of the time it is controllable. Most of the time you need not worry about that, but definitely you should make sure that there is nothing red flag or alarming signs. So if you take care of all these things, definitely it will be very helpful for you. Thank you.